I'm Monty Moncrieff. I'm the Chief Executive of London Friend. London Friend is a charity that's been working since 1972 to improve the health and well-being of LGBT people in London. We work in mental health, drugs and alcohol, sexual health, and really the whole gamut of health and well-being for LGBT people and communities. So London Friend runs a range of coming out support groups, social groups and activities, as well as a counselling service that can help improve LGBT health and well-being. Our groups are there to provide a place for LGBT people to meet away from the pressures of the bar and club scene, and to provide a space where people can get to know each other without the pressures that come with the commercial scene sometimes. Some of our groups are supporting coming out for gay, bisexual men, for lesbian and bi women, and for trans and non-binary people. We know this is still an issue for a lot of people, particularly if they come from communities where being LGBT isn't as widely accepted. So we have a counselling service which provides 12 sessions of counselling for people who are LGBT, who want to explore any aspect of anything that's going on in their lives. We also run a specialist LGBT domestic abuse counselling service for people who've been affected by domestic abuse. Our Antidote service is an LGBT drug and alcohol service supporting people who want to give up or cut down on their drug or alcohol use. A lot of the work that we do there is supporting chemsex, but we're also supporting people who are using only alcohol or using other substances as well. We can do some one-to-one support with people, helping them to look at why they might use or drink, how they can cut back, how they can manage their goals, and how they can deal with the trigger situations that they might find themselves in when they're tempted to use more. We've also got some group programs as well that look at maybe some of the underlying issues that might be there for people as well, in why they're drinking or why they're using drugs. We've adapted our services quite quickly to be able to meet some of the new needs that we've seen emerging, particularly around mental health and well-being. So we've been providing some new one-to-one support and group support for people to help manage their feelings during lockdown, help think about what kind of things are going to help improve their well-being, and also these are strategies which people can adopt in the longer term as well. All of that new lockdown support is available online, and everything we're doing at the moment is online until we can get back to face-to-face services. We know that some people can't access online or it's more difficult, but actually we found for a lot of people it's actually easier to access online. We've had fewer people cancelling appointments, fewer people not turning up, so it's been a real change in the way we work, but for many people a real positive change about the way that they can access the support more readily. So yeah, obviously we're called London Friend, so we are based in London, so all of our services are open to people who live or work in London. Unfortunately, we are able to work with people outside of the local area at the moment. We're just London based, but we are looking to see how we might extend some of our services nationally.